We are live. Hang on.
Okay.
Whoops. Okay, now we've got it. All right, got all of our buttons pushed. Well, welcome everyone this afternoon back to White Sands Self-Care Community. As you know, I am your host, Laura Cross, and I am excited to have with me today Dr. Rick Rimler, and who does orthotics. And I'll have to say, when I first met you, I was surprised that you even mentioned holistics because I've never heard holistic go with orthotics. So why holistic?
Well, it's actually holistic podiatry.
Okay.
I'm one of the few holistic podiatrists in the US. I basically created my own niche in podiatry, and the orthotics are a product that I designed. I designed my own working with a lab, which goes hand in hand with the holistic principles that I practice. So basically, with the reason why I'm holistic is when I met my wife, she was dealing with fibromyalgia, and she was put on 5 prescriptions, and she was told that she should go on full disability for the rest of her life. And she said nothing doing. And this was right at the time when fibromyalgia was not even an official diagnosis. So they used to say that people were just depressed or this and that. And it was like, it actually, because there's no blood test for it. So she actually did her own research and started tackling it in, one piece at a time. She started going gluten-free with her diet, and she found that by doing that, she knocked out a lot of the pain that she had just by doing that. Because
Wow.
gluten can be the trigger to 100 different autoimmune reactions, including irritable bowel syndrome, psoriasis, fibromyalgia, Crohn's disease. All of these different diseases can potentially be traced just to gluten sensitivity. So
Wow.
anyway, so she was smart enough to go do this research, and then she started introducing more things, such as dairy-free, and taking some key vitamins and supplements. And she systematically got off every single prescription. She was told she would never run again or barely even walk again. And she's a behavioral therapist. And so what she did is she took her principles of what she does in her profession and she did it for herself. So she started walking a half a block. Then she walked a block. Then she walked 2 blocks. And she gradually built up so that she could start running again, to the point now that now we're married 20 years this year. This will be our 20th year being married. She and I met her right at the beginning of this journey, that she takes a boxing class where she is going 10 rounds with hardly any breaks for an hour. And
Wow.
this is somebody that has a chronic disease, where if you see these chronic disease groups on Facebook, unfortunately, the vast majority of them are bedridden many times a week. And it's just a terrible life encompassing disease that doesn't have to be that way. Now, I'm not saying that gluten is definitely the answer, but it can be. Just
Right.
and if that is the reason for the autoimmune disease, just by doing that without taking any medication can be the answer. And then you add other things. So that was my influence to thinking outside the box. When I graduated from podiatry school in 1986, and they gave 30 minutes of nutritional training in school. I was always into the medicine and the biomechanical part of podiatry. I was never very happy with the treatments that they were giving me, like a cortisone injection. People don't realize that cortisone might help the pain temporarily, but
Right.
guess what, Laura? It gives tissue destruction in the spot where you give it. And then it can have long-term systemic effects if you have multiple injections. And then it can affect your immune system actually in a bad way. So in the back, even Advil and Aleve, taking one can land you in the hospital with a stomach ulcer.
Wow.
So people are popping those like candy. They feel it's over the counter, so it must be safe, but it's not. And I was always wary of even giving those treatments. So it was a godsend to like be introduced to, wait a second, there's another way to treat these problems. So I took it upon myself to learn it. And of course, I'm much better now than I was 10 years ago. It's a learning curve. And every day I strive to get better and better as a doctor and improve my modality and my protocols that I do. So I was able to now pretty much everything I see in my practice now, I can have a holistic option if the patient wants to go along with that. And usually they do.
Yeah.
Even if they didn't know I was holistic when they first came in to see me, I tell them that I'm holistic and they usually go, I say at the very least, let me try my way first. And if it doesn't work, I can give you a cortisone shot, next week or in 2 weeks. Usually it works though. So that's something that I'm very proud of. And it's something that, again, people don't even realize that medical doctors can be holistic, but let alone podiatrists. So basically, it's something where I'm trying to educate people to the safest possible approach. I took the Hippocratic Oath when I graduated from podiatric medical school,
Hmm.
and the Hippocratic Oath says, first, do no harm. And I take that really seriously.
Yeah.
If I can come up with a safer treatment, then I'm going to do it because I don't want my patients having a drug interaction or ending up in the hospital. So that's the medicine part of it. And then so I use natural anti-inflammatories instead of cortisone shots, and I dose it appropriately so that I can get rid of the problem safely, but also I try to get rid of the problem really fast so that by the time I see them the week after, they're good. And I usually am able to do that. So I'm very proud of that. Then I move, I the second part of my holistic 1-2 punch is the orthotics. So typically, orthotics are prescription arch supports. And if you go to a podiatrist, they're inevitably going to be charging the patient, and it's usually not covered by insurance. It's going to be $500, $600, $700. And I found it very frustrating when I was trying to charge the going rate, most of the patients would say, no, no, I can't afford it. So I
Right.
said, I need to come up with an idea to make it more affordable and also for me not to have to spend too much time in order to make the whole product prescription so I can do a turnaround time, not taking too much time. So it's cost effective for me, but also mainly making it economical for the patient. So I was able to do that. I found an orthotic lab to work with me with my idea, and they were able to do it, to execute it. So I started doing this in my office successfully, finding very well received on the recipient's end. My patients were all very happy because I tried to make sure that the first thing was that they were comfortable. Then from there, even my firm orthotic, it has some flexibility because you have to be able to wear it in order to get the benefits from it. And
Right.
so then from there, I developed my own biomechanical theories on what to put into it to make it effective so that the foot, the lower extremity, all the way up to the back becomes stable. So if you have a stable foot, whether it's a hard foot, what I call a rigid foot, or a flat foot, you have to make them both stable. And then by doing that, you're going to cut down on injuries to the foot, ankle, knee, hip, and back. And you're going to promote you're going to greatly lessen the chances of injuries. So you're taking the problem and you're trying to prevent future problems and you're promoting functionality too. So you're balancing out the foot. So that's why you compare it to, for instance, the Dr. Scholl kiosk that you step on. It's basically a footprint. But
Mhm.
when I evaluate the patient, I'm looking at the footprint, but that's only part of it. The main thing is when I evaluate the entire foot, and I'm coming up with what their foot type is. And that to me is the key thing. What category foot are they? And then from there goes the prescription and the material. So if they have a hard foot, if you look behind me, there's a patient of mine got me the yin and yang, but instead of the faces in there, he has 2 feet.
Yep.
So I call that the yin and yang theory of of my biomechanical theory of podiatry. If you have a rigid foot, you put a soft material under it. If you have a flat foot, you put a firmer material under it, but not too firm because it still has to be comfortable. And then you also have to look at not just the foot, where I find that a lot of podiatrists have tunnel vision and they're just looking at the foot. I want to know if they have a back issue. I want to know if they have neuropathy. I want to know if they have burning pain at night. That's going to influence the material that I'm going to use, because if they do, I'm going with my softest material, even if they have a flat foot, because I want that it's going to be much harder for them to tolerate it if they have a sensitive foot. So I developed a sensitive foot orthotic for that reason. My softest material, put the prescription in it, but make it as soft as possible so that there's a fighting chance that they'll be able to wear it comfortably all day. So that was my goal. I was able to do it. So I did it in my office, Laura, and then I moved it onto an online store that I have on my website. So for people that are not geographically in South Florida, then they can easily get something that is much, much better and affordable compared to what they would get over the counter or on Amazon, which is basically not an orthotic. That's just an
Right.
art, like an insole or an arch support. And not only is it a lot less expensive than what they would get from a podiatrist, but I happen to find that a lot of even podiatrists are making the wrong call on the material that they're giving the patient for their orthotic. So I have I'll give you an example. A 90-year-old lady comes in. She just went to a different podiatrist prior to me. She got this orthotic, and I'm looking at it. There's no flexibility in it. And I'm
Mm.
going, this orthotic should not be given to somebody over the age of 20. Granted, she had a flat foot, but she's also 90. So you cannot do that. That's the holistic principle towards biomechanics. You must look at the whole body. You must look at the fact that maybe the fat pad on the bottom of their foot when they're 90 is going to be thinner.
Right.
Therefore, you can't put a rigid orthotic in that person and expect them to be comfortable and for them to wear it all day. It's just not going to work. So that was my baby that I was my goal to be able to get and make it accessible. So that's why I have it in my online store and I'm proud of it. And it's something that I can say that I've been using it in my office for almost 10 years now. So the track record is there and I have very few problems when I used to do the fancier orthotics, believe it or not, I used to have a lot more problems with the patient coming back saying, the arch is too high, or this hurts, or this,
Mhm.
all these different complaints. And I get very few problems because I try to I right at the start, I made the materials more comfortable. And then I'm also doing everything in my power to get it right the first time.
Right. Otherwise, people get frustrated and they like pull them out and then they don't ever want them again because they don't work. And so
Right,
they continue to suffer in
right.
pain. You mentioned those cortisone shots. I've had plantar fasciitis before in the past, and thank God I haven't had trouble with it for years. But yeah, when they're sticking the needle in and rotating it like 360, that is a very painful, very painful process if no one's ever had that done. But you also have what you call your prescription for interval training.
Yeah.
So what exactly is that? What does that mean?
Yeah, that's the number one thing that I like to educate people on because, we just had January 1st, so everyone's making their New Year's resolutions. They want to start exercising more regularly. But what is the advice that's given by their doctors and by the mainstream media? And I see it all every day. You must exercise 3 to 5 times a week for 30 to 60 minutes. Okay, so maybe the month of January, if you're lucky, you're going to do that. Then by the time February comes around, you're going, I can't do this. I don't have the time. So this was something that I found out about when I was 50. Luckily, I started implementing it right then and there. And then I took this idea, which was originally stated by this anti-aging doctor in South Florida, who I got information from. And I then made it my own prescription because I wanted to make it more realistic. the prescription that I was given initially, I didn't find realistic, and I was in good shape as a 50-year-old, let alone someone that's overweight and age 80 with diabetes and heart trouble. It would certainly not be a realistic. So I came up with a realistic way, and there are scientific studies that back it. So basically, my version, and I renamed it even. Instead, most personal trainers will call it high intensity interval training. I don't want people to get intimidated if they're not the Olympic athlete. So I
Right.
took away the high intensity. Let's just call it Doc Rick's prescription for interval training. And it's basically fast, slow in a realistic way, going faster at the end. So it only takes 12 minutes, roughly. Anybody can do it, even if you're 90 and in a wheelchair. There are different ways you can do it, and it doesn't take a long period of time. So I'll tell you exact. So the thing that I like to say is, if you can do it first thing in the morning to start your day, that's the best time to do it, because it gives you so many physiologic benefits, emotionally also, stress
Yeah.
management wise. But you start your day and you have already accomplished that, rather than having to do that at the end of your day when inevitably things come up. You have to go to the store, you have to pick up the kids from school, you have to go to the vet, you have to do this, you have to go there. So it's better to just do it first thing in the morning if you can. It only takes 12 minutes, so it's only taking, and you try to do it close to home so you don't have to drive anywhere to do it. I'll tell you what I do personally.
Okay.
I go out on my street. I sprint for 20 seconds. Then I walk for about a minute and catch my breath. Then I go the other way 20 seconds. I do that 6 times. Then the final three, I sprint for 15 seconds and I walk after each sprint another minute to catch my breath. So you're not going too fast, you're not going too long on the sprint. And if you can't sprint, of course, you can jog, or at the very beginning, fast walk. So you just walk at a faster pace and then bring it down and walk slow, catch your breath. So it's basically six, the starting point is 6 intervals of 20 seconds fast, followed by 3 intervals of 15 seconds fast. The key point to know is that when you do the final three at 15 seconds, you do them faster. And by doing that, that's where you're going to get many, many more benefits than the typical interval training will give you. And those benefits include improving the strength of your heart and your lungs versus long distance running that actually makes your heart inefficient. You'll increase oxygenation all over your body because of the change of speeds. So that's going to prevent Alzheimer's. You're going to oxygenate your brain better. You're going to oxygenate your joints better. You're going to cut down on arthritis pain just with the change of speed. It's also going to put you in a 12-hour afterburn of fat. So if you reduce your white flour in your diet, you're going to start burning fat for the 12 hours after you stopped working out. So that's going to be for weight loss. It's going to be for maintaining your weight. It's going to give you that endorphin release as if you ran for an hour, just the same, because you're giving the short, fast spurt. And that's going to give you your endorphin release, which will give you that nice Zen effect. That's why I say, if you can start your day that way with a nice cup of organic coffee, that's a great way to start your day. And then ultimately, the kicker is that this method, by going faster at the end, is anti-aging. It keeps your chromosomes long. You will not age as fast. So I am proof of it, because I started doing this when I'm 50. I'm going to be 64 this year.
Wow.
And so I have been doing it Monday through Friday for 14 years. I make it a point to go to the gym twice a week on the weekends. I usually go Friday, Sunday, and do a full body workout. You have to do the weight training too. That's very important to keep your muscles strong, to prevent your muscles from wasting as you get older, to keep your joints strong by improving the muscles around the joints. You're going to help arthritis. You're going to help your posture, and you need to be doing that too. So, but the key point is the aerobic part does not have to be an hour. It can be short and sweet, and you can do it walking, you can do it jogging, you can do it sprinting, you can do it on an exercise bike, you can do it on an elliptical, you can do it swimming in the pool, you can do it in the shallow section, running in place in the pool. There's so many different ways to do it. So the patient of mine that has a wheelchair that I was telling how to do this, they're in a wheelchair. I just told them, get a floor pedal from Amazon or the medical supply that's $30. It's just pedals that stand on the floor. You sit in a regular chair, you put your
Mhm.
feet in the pedals as long as you have use of your feet, and then you can do your pedaling right then and there, right in your house. You can do it that way. So it fits everybody, no matter their medical history. Of course, I always say to check with your medical doctor first to make sure that you have the go-ahead to do
Right.
this method. But I don't expect a 90-year-old when they're doing their fast intervals to necessarily do it too fast. But just it's a question of do it a little fast and then either slow down or stop for a minute, whichever one you have to do, and then just do it again. The key point is you want to take the fast intervals that you do, and it just has to be 2 minutes of time. So you can tweak it any way you want. You can, if you can't go fast for 20 seconds, you can go fast for 15 and do your first 6 at 15, excuse me, and then finish at 10. You can tweak it any way you want. Just make sure the final 3 are at a shorter time than the beginning, and make sure you're doing them faster. And then all of these major benefits are coming your way. So that's the thing that I want people to know, that you don't need to spend inordinate amount of time doing this. And it's best to be able to do it, let's say Monday through Friday. Just get into the habit of doing it. If you're not a morning person, fine. Don't do it in the morning, but do it lunchtime, do it at the end of the day. But remember, it's only 12 minutes, so just don't procrastinate and don't put it off. Just try to do it. If you're not going to do it in the morning, it makes it harder to stick to it. But as long as you don't have an hour hanging over your head 5 days a week, at the end of the day, you're more likely to be able to do it.
Yeah, definitely. Yeah, that is the key, and a part of the key is starting, because building habits, you have to start. So a lot of times we, like you
That's
said, we procrastinate, we don't start.
Yeah, you have to take one step at a time, literally.
Yeah.
And so like my orthotics go hand in hand with the interval training as long as you're not doing it in the pool. You want the right foundation in your shoe. You take the insole of the shoe out, the orthotic goes in, there are eyeglasses for your feet. Let me just make a quick little point about shoes. You want the back of the shoe to be very firm. The part behind your heel, most shoes are not like that. So make sure when, at the very least, when you're exercising, or even when you're doing a lot of walking to shop, make sure the part behind the heel is firm.
Okay.
You want the insole to come out, orthotic goes in, and then you want a lace or a Velcro, excuse me, and you want 1 inch from your longest toe to the end of the shoe, which is the width of your thumb.
Hmm. Yep, that's probably another problem too. A lot of us do. We kind of get attached to shoes, or you can't find ones you like in your size, and you wind up cramming your feet into shoes that are really too small for you.
Exactly.
So,
Excuse me, I'm just getting sucking candy.
yep. I have that every now and then. You get them little dry, little dry dust things that hit, and whoop, there goes the neighborhood. So, what is the best way for people to connect with you and get a hold of you?
Right now, my website is called Start With Your Feet. So that's the way to get in touch with me is Doc Rick at startwithyourfeet.com. It's ultimately going to be changing over to a new name called thedocrick.com in a couple of months, but you can still go to Start With Your Feet and it'll carry over.
Okay. Well, that is wonderful. I'll make sure I put in the comments exactly how people can get a hold of you. And because I know that's a big issue, especially like you said, if you have back problems. And I love the fact that you, like, look at the whole body, because I know people that are suffering from plantar fasciitis and neuropathy at the same time and have back issues. And so that's, people that are suffering from that. It's nice to know that someone has a holistic approach that can help them and take a look at the whole thing. So
That's my thing. I want people to know that there are other ways to treat the same problem that are safer. And then also, what I do after I finish getting the patient past the problem that they come to me for, I will put everybody on a strong probiotic because there's no drug interaction with a probiotic. Probiotics are the healthy bacteria that line your gut. They promote your digesting your food, they improve your immune system, and they reduce musculoskeletal pain and inflammation. So everybody can benefit from that. So I want people not to have the same problem over and over again. But by giving the probiotic recommendation, I'm also giving a positive side effect. I'm reducing their chances of stroke and heart attack because I'm reducing inflammation in their body. Reducing inflammation causes 90% of all disease. We're not talking about viruses, we're talking about inflammation.
Right. Hmm.
Keep the inflammation down in a safe way using things that are not going to cause stomach ulcers, and you're going to be a healthier person.
Yeah, absolutely. Well, I want to thank you for taking the time for sharing that with everybody here. And please, when you get your new stuff up, the doc brick and all that, make sure you share it with the group. And so that we know, because I know you got more exciting things on the horizon and stuff, but I think we've given people a lot to digest right now. But I love your approach that you do all that. And thank you for taking the time to share that with everybody.
Thanks a lot, Laura, for having me.
Thank you. And everybody, you have a great weekend. If you missed this, you can always catch it on the replay on the White Sand Self Care YouTube channel. But I want to wish everyone have a happy weekend. I don't know about you guys, but we're supposed to have beautiful weather. So I think it's time to go out and enjoy some beautiful weather. So we will catch you next week.